We're breaking into regular programming right now for a WCIA 3 special report. Governor Pritzker is giving his daily update on COVID-19 from Chicago. We join him now.
Thank you for joining us once again today. I want to begin today by asking all of our licensed healthcare providers across the state to sign up for a new emergency alert system so that in the event of an urgent need, our public health officials will be able to ask you for your immediate assistance. This includes all physicians, nurse practitioners, registered nurses, physician's assistants, respiratory specialists, medics, LPNs, certified nursing assistants, podiatrists, dentists, anyone who has made a career in the medical profession. This is different than the siren system that's for doctors only. This is for emergency alerts for all our licensed healthcare workers. Please register on our website at illinoishelps.net. illinoishelps.net. Your fellow Illinoisans need you. Your state needs you. By signing up, you'll be joining an alert system that, when activated, will ask you to deploy to assist in our response to urgent needs during this public health crisis. Together, we truly can make a difference, and that difference will save lives. Again, I ask you to register yourself at illinoishelps.net if you're in the medical profession in any capacity whatsoever. Please go to that website and click on Register Now at illinoishelps.net. Additionally, thanks to your amazing outpouring of support, our healthcare workforce is expanding. We have now received more than 510 applications from former healthcare workers to get back into the fight. And we began sending out the expedited temporary licenses and permits yesterday afternoon. Still more healthcare workers are needed. If you have recently retired or left the profession to start a new career, please come back to work for at least the next few months to help us battle against COVID-19. This afternoon, the United States House of Representatives passed the $2 trillion emergency aid package, and we await the President's signature on that very important bill. I'll continue to work with our federal counterparts to bring in as many dollars home to Illinois as possible. I want to take a moment today to address some of the latest ideas that have been floating out of the Oval Office. President Trump yesterday went on a talk show to question whether Americans really need more ventilators to save people's lives. He did this on the same day that our nation overtook China and Italy, having the highest number of COVID-19 positive cases. To say that these comments are counterproductive is an understatement. And frankly, at worst, the comments are deadly. When I said that the bedrock of my decisions was science, I meant it. The equipment we have, the equipment we're still seeking, these are the recommendations of the best medical experts, epidemiologists, mathematicians, and modelers in the nation, all of whom have set aside their daily duties to help save as many lives as possible. We need exactly what we're asking for, perhaps more. If we don't get the equipment we need, more people will die. The President needs to use the Defense Production Act to put order into the market for ventilators and PPE. It will prioritize Americans over foreign countries and allow states on the front lines to access the equipment we so badly need. He needed to do this to activate the Defense Production Act weeks ago, or even yesterday. But it still will make a massive difference in our national health care system if he simply moves quickly. One way or another, we need these supplies. And I have a whole team of people whose singular focus right now is working the phones, calling across the world to get as much PPE, as many ventilators, and as many tests as possible shipped to Illinois. This morning, because of my state team and their hustle and working all hours of the day and night, we received another shipment of state-procured N95 masks, and they have been in the process of delivering stocks of PPE, that is our staff, to Champaign, to Peoria, Edwardsville, and Marion. We will not rest until each and every region of our state has what it needs. But without the federal government, individual states don't have enough market power to procure what is needed on their own. So I urge the President to join us in this work and take the federal actions that are available to him and to him alone. I want to provide you an update on what my team and I have been doing to ease the burden of this moment on our most vulnerable residents, our families, and our children. I'm glad to be joined today for the second day in a row by our Department of Human Services Secretary Grace Ho, whose staff has moved mountains and then some to increase the depth and breadth of Illinois' human and social services network, including easing access for newly eligible users and temporarily eliminating the renewal process wherever possible for organizations. We're also joined by Carolyn Ross, representing the nonprofit organizations across Illinois who are stepping up in this critical time. Most of you are adhering to our stay-at-home order, but not everyone has a home to go to. Not everyone has a safe home to go to. Not everyone has the same ability to put food on the table. Not everyone can stay at home with their children. These are problems that existed long before COVID-19, as did the need for a meaningful solution. But it is especially important right now that we are doing all that we can for all of our residents through this crisis. We want every eligible person to be able to access services as easily as possible. So I want to walk you through our ongoing efforts to simplify and expand the available support. As I go through these offerings, if you need any of these services, you can find more information on accessing all of these measures at our main coronavirus website, coronavirus.illinois.gov, coronavirus.illinois.gov. And please, whenever possible, do use our websites if you can. Although our regional offices remain an option for those who need them, for your own safety and that of our civil servants, I ask you to avoid visiting our offices if you can access the internet and get what you need online. First, let's talk about child care. I announced exactly 1 week ago that we were going to make sure that our essential workers have safe daycare for their children while they do the critical work that keeps us safe. While children who can stay home should stay home, we want to make sure that every child in Illinois has a safe and supervised place to go. I'm proud to say that we've received more than 600 applications for small group emergency child care licenses from people, organizations, schools, and communities looking to help their essential workers, from healthcare professionals to grocery store employees. Additionally, hundreds of our child care homes are staying online to provide care in socially distanced settings. And now we will be providing each of the providers who stepped up in this time of need with an additional stipend, $750 each for licensed homes, $2,000 each for centers running 1 or 2 classrooms, and $3,000 each for those running 3 or more classrooms. Applications for these grants will be available beginning Monday through your local child care resource and referral agencies, and again on our coronavirus website, coronavirus.illinois.gov. Parents and guardians looking to find child care should call our toll-free statewide number, 888-228-1146. Again, that's 888-228-1146. Or to visit our Families and Children resource page on coronavirus.illinois.gov. My administration is also working closely with the statewide hospital and healthcare associations to make sure that our state's hospitals' child care needs are being addressed. I also want to talk about food access, something top of mind for so many parents as schools have closed and layoffs have skyrocketed. First, I want to remind everyone that as long as schools are closed, students who qualify for free and reduced lunch can get their meals through their local school districts. And we continue to encourage school districts to work with our Illinois State Board of Education and the U.S. Department of Agriculture to expand their programs to all of their area kids. As for programs like SNAP and the Women, Infants, and Children program, WIC, my team at the Department of Human Services is submitting multiple waivers to the federal government to deliver as much nutrition support to as many Illinoisans as possible. Already, we've been able to automatically extend SNAP certifications set to expire March, April, or May another 6 months until September, October, and November. We've also been able to waive the physical presence requirements for SNAP applicants and participants, enabling people to further reduce the time that they spend outside their homes and increase people's ability to apply for assistance online. Anyone who needs to apply for or to adjust their SNAP benefits can now do so remotely on our Department of Human Services website at dhs.illinois.gov. Again, if you need to adjust your SNAP benefits, you can now do that online at dhs.illinois.gov. We're expecting an additional $80 million in federal money to come to Illinois in April through the SNAP program. That's another $80 million of food on the table for our residents that also stimulates our local economies. That's real impact in our communities. And I'm grateful to the team at DHS for all their work to bring as many federal dollars as possible to Illinois. Illinois is also home to many residents who don't have a permanent home to stay in. DHS has gone through its budget with a fine-tooth comb and redirected millions of additional dollars to address all aspects of homelessness assistance statewide, with a focus on expanding our ability to offer temporary shelter. That's on top of the doubling my administration has done of the state homelessness prevention program over the last year. We're also increasing all of our existing state homelessness service contracts by an additional 5%. That means more dollars to homeless shelters and permanent supportive housing. These extra dollars will help our partner organizations enact social distancing measures within existing spaces. Finally, if you're experiencing domestic violence or you live in fear of it, I know how much scarier and more complicated the message of stay home might sound to you. If that's the case for you, please know that you can call our Illinois Domestic Violence Hotline at 1-877-863-6338. Again, if you are experiencing domestic violence or live in fear of it, you should call our Illinois Domestic Violence Hotline at 1-877-863-6338. Thank you, and now I'd like to turn it over to our Illinois Department of Public Health Director, Dr. Ngozi Ezike, for today's medical update. Doctor?
Thank you, sir. Thank you, Governor. And again, just thank you for your passion and your commitment to the people of Illinois. You should all know that he is an ardent supporter of science, and he's pursuing every piece of data that we can give him to make sure that he is making data-driven decisions to make the most important, difficult decisions for the people of Illinois. And I thank you for being that kind of leader. Today, I'm sad to report that there are 488 new cases in Illinois for a total of 3,026 individuals with COVID-19. Unfortunately, this includes 8 additional deaths for a total of 34 lives lost since the beginning of this pandemic. We also have additional counties that have been included in the rolls. We have 40 counties across Illinois. As we expected and as we have feared, the greatest number of hospitalizations is among individuals older than 65 years of age. And approximately 86% of those with COVID-19 who have died here in Illinois are over the age of 60. We must continue to do all that we can to protect our older adults, our grandmothers, our grandfathers, who are most vulnerable to serious illness and death. We also must make sure that there are enough medical professionals to care for those who do endure the more severe illness and the attending complications. Again and again and again, I want to thank our medical and our healthcare workers who are literally on the front lines. While we are telling the public to shelter in place, to stay at home, we are asking them to go where the patients are, to go where the illness is, to save their lives. We are asking for all licensed healthcare providers who are able to join the response: physicians, nurse practitioners, physician assistants, medics, dentists, podiatrists, registered and licensed practical nurses. Everyone, please register at illinoishelps.net. Since March 19th, over 1,000 medical and non-medical volunteers have registered to help in our fight against COVID-19. All of these individuals will be critical, but we still need to have more help as this pandemic continues. I also want to thank and offer words of encouragement to those who are providing essential services and those who are supporting the people who are providing essential services. These include people who are providing daycare for the children of those who are providing essential services. It also involves the sanitation workers who are keeping our workplaces clean. We all have our parts to play, whether it's a healthcare provider, a person providing an essential service, those who are supporting others to do their work, whether you're staying at home as you've been instructed, whether you're a kid foregoing your play date, washing your hands frequently, keeping 6 feet away of distance. All of these steps is what it will take, all of us doing this together, to end this pandemic. And now I will repeat the comments in Spanish. Hoy estoy reportando 488 casos nuevos, un total de 3,026 personas en 40 condados del Illinois. Desfortunadamente, esto incluye 8 muertes adicionales para un total de 34 vidas perdidas. Como pensábamos, el número de hospitalizaciones son personas mayores de 65 años. 86% de las personas con COVID-19 que han muerto tienen más de 60 años. Debemos proteger a nuestros abuelitos y abuelitas. Ellos son más vulnerables a enfermedades. Quiero decir gracias a nuestros trabajadores médicos que están en primera línea. Solicitamos que todos los proveedores médicos con licencia que pueden ayudar en esta respuesta se registren en www.illinoishelps.net. Tenemos más de 1,240 voluntarios médicos han registrado para ayudar en nuestra lucha contra COVID-19. También quiero decir gracias a las personas que están dando servicios esenciales. Esto incluye a las personas que cuidan a los hijos de nuestros policías, enfermeras y bomberos. Nos tomará todos trabajando juntos para poner fin a esta pandemia. Con los voluntarios y trabajadores vamos a levantar Illinois. And with that, I will turn it over to Secretary Ho.
Good afternoon. Now more than ever, the value of and the necessity for human and social services is clear. Like healthcare and safety, essential life-giving and life-altering human services are not only still available, DHS is expanding and adapting access to services for individuals and families across the state who need help now. Thanks to the strong, kind, and clear leadership from Governor Pritzker, we are also working to ensure that Illinois' Human Services Network is able to be sustained through this crisis and beyond. DHS exists to ensure that the basic needs such as shelter, food, health care, mental health, services for people with disabilities, and child care are met. We have a workforce of 13,000 strong, providing direct care at psychiatric hospitals, at state-operated facilities for people with developmental disabilities, and public benefit offices all across the state. I am grateful to them for their dedication to helping our neighbors in our state through this crisis. To our nimble, responsive caseworkers, counselors, and call center agents who continue to help people every day, we thank you. I want to salute the nurses, mental health techs, personal assistants, direct support professionals, and other frontline employees whose often stressful, sometimes challenging work is even more intense during this public health emergency. During this pandemic, DHS's own employees and our network of 500-plus state-funded community partners are ramping up our efforts in several areas. When families and individuals experience a challenge in their lives, prenatal to older adulthood, DHS and its partner organizations are often the first place people turn to for refuge. We reach 1 in 3 people in the state of Illinois across the state with dozens of services, and there are too many to list. So I encourage you to please visit our website, dhs.illinois.gov/helpishere, to learn more about the wide array of supports available to those most in need. Today, I would like to quickly highlight and go into a little bit more depth about 4 crucial resources for communities across Illinois. SNAP, the Supplemental Nutrition Assistance Program, services for people with disabilities, the Emergency Child Care Program, and expanded services and supports for people who are experiencing homelessness. As the governor shared, SNAP is a federally funded program that puts food on the table for nearly 900,000 Illinois households, feeding over 1.7 million people in our state and stimulating our economy. People eligible for SNAP include low-income seniors and individuals, people with disabilities, and working families. With the recent passage of the federal Family First legislation, monthly SNAP benefits will increase dramatically, in some cases by over 90% a month. For example, a single person with a disability or an older adult with less than $2,000 of monthly income is eligible for $194 in monthly SNAP benefits now. Before the legislation passed, they would have received $16 a month. A family of 4 making less than $42,000 a year is now eligible for $646 a month in SNAP benefits. Our administration, as always, want all eligible people to receive these basic benefits and, as always, are in the fight against hunger. This is important now more than ever. The Department of Human Services has been quickly implementing federal measures and submitting waiver requests from the federal government, as the governor had mentioned, for temporary measures to increase flexibility. We have and we will continue to implement ways to help more families withstand the extraordinary pressures many are facing during this emergency. We know some SNAP participants may be unable to get to the grocery store. If you have a trusted home care provider, a family member, or friend, they may help you access some of those benefits. I would like to reiterate what the governor had noted in his remarks because it is an important point. With recent changes, SNAP expenditures for just 1 month, just for the month of April, will increase by almost $80 million over March. That's $80 million more a month, rolling up to about $300 million of federal assets and resources that are being pumped into the Illinois economy each month, while also putting food on the table of Illinois residents. While some of our offices are still open, we do urge individuals to stay at home to sign up for SNAP and other benefits online. Over the course of the past several weeks, we have been building up our virtual capacity. Please help us keep you and our local office caseworkers safe by staying home. In addition to SNAP, included among the array of services our Human Services Network provides, there are many resources for people with disabilities. More than 30,000 people now rely on the aid of a personal assistant through the Home Services Program. This program continues to promote the independence of all people who may need limited or significant supports to carry out the activities of daily living. For people with intellectual and developmental disabilities, DHS continues to make home, community-based, and other residential services available for over 30,000 families. DHS and our community partners across the state serve people with physical, intellectual, and developmental disabilities and people with mental illness. If you or a loved one needs help, please call or visit our website, dhs.illinois.gov/help-is-here. As the governor shared, the Department of Human Services, with the governor's office and our sister agency, Department of Children and Family Services, launched the emergency child care program that is available for essential workers who have no other options available. In these settings, capacity will be limited to the number of children per classroom and per site. Information can be accessed through the Governor's Office of Early Childhood Education and the array of websites that we have talked about today. Before I close, I'd like to highlight DHS's work to support people experiencing homelessness. Over the past several days, we have been working relentlessly to build on the infrastructure of shelters and programs that have been partners with the state for many years to meet the dynamic needs of people experiencing homelessness during this crisis, helping our partners enact social distancing measures for this population. DHS already funds hundreds of organizations who serve people who experience homelessness through shelter supports, prevention, and supportive housing. Last week, we announced a 5% increase to all of these initiatives and an additional $6 million in new funding to support the 19 continuums of care across the state. These continuums will be our local partners. In designing this expansion, DHS sought to be swift, flexible, accountable, and ensure locally driven decision-making. These organizations know their neighbors and their community assets the best, so we are deploying funds through one fiscal administrative agent to support their work. We are pleased to be partnering with All Chicago in this effort to meet the needs of people who are experiencing homelessness right now. I am pleased to introduce Carolyn Ross, the President and CEO of All Chicago.
Thank you to Governor Pritzker and Secretary Hull. Thank you so much for your leadership to ensure that all Illinoisans have a safe place to shelter during this COVID-19 emergency and beyond. Our mission at All Chicago, Making Homelessness History, is to unite our community and resources to provide solutions that ensure and sustain the stability of a home. We work to prevent and end homelessness through 4 signature approaches: community partnerships, data analytics, emergency financial assistance, training, and research. All Chicago is responding to the coronavirus crisis by supporting the community with some planned strategies. We are reviewing and publishing information to inform operational responses. We are distilling information from hundreds of pages of guidance from the city, from the state, and federal authorities, focusing on what is pertinent to shelters and other providers that house clients together and living in close proximity. We are using an online channel where providers can talk to each other directly and share information quickly. Calls with providers are being held every week with more than 200 partners participating. We are increasing our availability to help disperse resources using our existing emergency fund model to support our partner providers who are supporting and implementing services to our citizens who are at risk of or currently experiencing homelessness. Shelters and providers, our partners, are experiencing increased costs not covered in their current budgets. This new emergency funding, we are grateful, as it will help mitigate some of these needs and enable our providers to adhere to CDC and CDPH recommendations. The Department of Human Services is making $6 million available throughout the state for emergency lodging for individuals and families experiencing homelessness. These flexible funds will be made available through local continuums of care, as the Secretary mentioned, which are local and regional planning bodies recognized by the U.S. Department of Housing and Urban Development to coordinate housing and services funding for our neighbors at risk of experiencing homelessness. We are jointly developing a process with DHS for application and distribution to ensure a clear and expedited process. Each COC lead agency will be responsible for local prioritization of funds in collaboration with local planning efforts in response to this emergency. Through the COC, the federal government promotes local control and allows the people on the front lines doing this work to help shape the support for people experiencing homelessness. All Chicago and DHS, we maintain and have had an effective partnership and in our collaborative effort to address homelessness. Based on our current work together, we appreciate that DHS turned to us in partnership to support the 19 continuums within the entire state of Illinois in response to the needs of the distinct communities that they represent. DHS has enlisted All Chicago to serve as the fiscal agent for this fund. Lead agencies throughout Illinois will access funding through All Chicago and work with local service providers to pay for solutions that are responsive to the unique needs of communities throughout the state. The funds are intended to provide the temporary lodging costs for an effective response to the COVID-19 emergency. While the funds are intended to be flexible within that focus in order to supplement local resources and planning efforts, it is understood that these funds may not be sufficient to provide all of the necessary supports that homeless providers or persons experiencing homelessness will need during this time of this emergency and beyond. Some examples of support may include hotel and motel costs as temporary alternative housing identified in communities across the state, facility modification and expansion costs for some of our existing providers to equip and furnish alternative facilities and areas within existing facilities not normally designated for shelters. Increased staff costs to expansion of shelter provision in additional facilities so that we can keep these facilities operational. And other costs will be considered to allow flexibility to use funds to fill a critical temporary lodging need outside of what is previously listed. At All Chicago, we will continue our mission to support the community through our established emergency fund, in which Chicago residents can apply for assistance by calling 311. And ask for emergency assistance to receive these services through the Chicago Continuum of Care. For additional information, we have developed a link on our website at www.allchicago.org/coronavirus. And now I will turn it over to the governor for questions. Thank you.
Thank you, Carolyn. I just want to point out to everyone that although Carolyn represents an organization called All Chicago, she is representative of the organizations that are dealing with homelessness all across our state, and she's doing a terrific job here in this region and representing people across the state. But I just wanted those of you who are listening, watching, who are outside of Chicago to know that your local organizations are being funded, that our Department of Human Services covers the entire state of Illinois, and I'm especially concerned to focus on homeless people who often are forgotten, perhaps in the commentaries that get made, but who are so vitally important to our state. And we're going to make sure that we stand up for you no matter where you live in the state of Illinois. So with that, I'm happy to take any questions that you may have. Dana?
All right, as you heard there, the governor wrapping up the informational portion, at least from his administration, and switching over to questions. But just to recap a little bit before we return to regular programming, a couple of notes there. Nearly 500 new confirmed cases of coronavirus in Illinois, 8 additional deaths. That means there are more than 3,000 cases in the state and 34 deaths impacting 40 counties. The state's top doctor says about 86% of the people who have died are 60 and older. The administration promoted access to critical services. You can find those resources, dhs.illinois.gov/help-is-here. That offers assistance with food, shelter, medical, recovery, even someone to talk to. That's available there. More than 500 retired healthcare workers have stepped up and applied to help respond to the pandemic. And Dr. Ezike, again, the state's top doctor, is encouraging more people to step up, and they can offer their assistance through illinoishelps.net. So again, nearly 500 new cases of coronavirus in Illinois, 8 additional deaths. We will recap a lot of this information coming up on WCIA 3 News at 5. And, of course, you can find more information at WCIA.com. We'll now return you to your regularly scheduled programming.